Ooh.
Okay, so let me introduce you again. So I'm Dr. Maxwell. I am one of the pre-health advisors at UNC Asheville. And I want to introduce Dr. Jamison. She is a dentist here in Asheville. She actually grew up in Asheville and went away to school and came back to the state for dental school at UNC Chapel Hill, and is currently in her residency at MAHEC and is also in the Masters of Public Health program. So she is here tonight to tell us about her experiences and offer any advice that might, she words of wisdom about going through the process. So thank you for coming. And if we have to pause as we go, I can just pause the recording if you get a call, because I know you're on call. Yeah. All right. Take it away.
Thanks. Yeah, I did just want to lead with that. So part of the residency is that there's 7 of us residents, and we all rotate being on call for dental emergencies. So we'll get called into mission at the hospital. If people get teeth knocked out, we go in and put them back in and splint. Or if they have a really big infection in their mouth, we'll drain it, and it's always fun. But because of that, I am on call right now. So if I get a call, I'll have to just quickly pick that up. So thank you for your patience. So I didn't really prepare anything. I have the questions, and I'm just going to go through those. And if anybody else has any questions, I am more than happy to field those to the best of my ability. So like Dr. Maxwell said, I did grow up in Asheville. I went to Asheville High. And then I went to a small liberal arts school in Wisconsin for undergrad. And then I went to Chapel Hill for dental school. And I just graduated in May amidst the pandemic. So it was a great time. But thank you. So I do have a similar perspective of going to a smaller school. And I know that a lot of people, when I first was applying, or when I knew I wanted to be a dentist in high school. And so when I made the decision to go to a small school, a lot of people were like, oh, but that's not necessarily a feeder school into dental school, especially since I wanted to go to UNC for dental school. And a lot of people questioned why I didn't go to a big university, because UNC is a place to go if you want to then go to UNC Chapel Hill for dental school. So I have a similar perspective as y'all. I know that UNCA is a little bit smaller, so you are in a good place. So looking at the list of questions. So what drew me to dentistry and how I know it is the right career for me? Like I said, I wanted to be a dentist in high school. Also, sorry, Dr. Maxwell, how much time do I have?
This is scheduled for an hour, but and you might if people have questions as you go, if that's okay, if they can just throw those questions out, because it's really just, Absolutely. It's free form.
Wonderful. Okay. I talk a lot. That's the only reason why I'm asking. So I knew in high school, and the only reason I kind of got into it is because I did my senior year at Asheville High, I did a internship program. So it was a class, it was kind of like a loose form class for seniors who didn't really want to do anything else. And we could pick a place to intern. And I was thinking where I wanted to go. And I chose to go to my dentist's office. I was like, that's kind of cool. And so I went and I interned with her, which was just standing there and watching her work on patients. And it was really cool. It was really interesting to me. It's really beautiful. If you ever watch a dentist working from behind their shoulder, I've always related it to making little sculptures in somebody's mouth, little functional sculptures that they then chew on. And I know I talked to Dr. Maxwell as I was if I wasn't a dentist, I would be a jeweler. It's very similar. It's very intricate work. And I'm a people person. I really like working with people. So I was in my mind kind of thinking through what career would I enjoy? Would I be good at it or whatever? And I was like, oh, I love art. My mom's an artist. I knew I wanted to major in biology because I really liked science. And I was like, oh, this is great. This perfect. So that's what initially drew me, is I just like was there in the office and I was like, this is really cool. I think it's beautiful. This is what I want to do. So if you are interested in dentistry, I would definitely find a dentist to like watch at some point, because that's not for everybody. And I know people who went through dental school and came out the other side and were like, I hate teeth. I hate dentistry. And I'm like, how did you do that? Go through all of dental school, like shadow all these people, and you still don't like it. So it's not for everybody. But if you're interested, definitely go find a dentist that would let you like look over their shoulder. And to be honest, I'm looking at the question, if it's the right career for you, is dentistry is taxing. It's very taxing, like on your body. And just because like you're like working a lot. And so I'm still in the process of finding where I am going to fit into dentistry, because one thing that they don't talk a lot about is you look at dentists and you're like, this is the only path for dentists. And they don't really talk about other paths that you can go on. And so I think it is the right career for me. And I was fairly sure of that when I went into it. So I'm glad of that. But I do want to stress that there are a lot of different things that you can do with it. So you don't necessarily have to be private practice, working 5 days a week with patients. And there's so many different ways that you can use dentistry. If you like teeth, if you like people, if you find clinical dentistry really cool, like you can do that part-time. So there's a lot of different things. So I am still in the process of finding where I fit into dentistry the best. So what did I do to gain experience? So in college, like I said, I was up in Wisconsin. My sophomore year, I found a clinic, a dental clinic in the area. Like it was a random community health dental clinic. And I reached out to them to see if they would be cool if I shadowed there. That's all I did, is I like asked like, hey, I'm a student in the area. I'm really interested in dentistry. I would love to come shadow, like volunteer, do whatever. And so for the like 2 years following that, so like my sophomore year, my junior year, and partway into my senior year, I went every week to this dental clinic and shadowed them. And it was a teaching clinic because there's a dental school in Milwaukee, Wisconsin, Marquette. And so their 3rd and 4th year dental students would come up to this clinic and do some clinical rotations. And so it's a teaching clinic anyways. And so it was a really great opportunity because as a student, they let me assist, which was really cool. And so I'd be like in the patient's mouth. And so I was able to get a good idea of what dentistry looked like up close. And so I just kept doing that. And I would flip rooms after the patients were done. I would like help wipe down the chairs and everything like that. So I would like try to make myself as helpful as possible and as minimally annoying as possible for them. And just like kept it up and just kept going and developed like rapport with the assistants who were there so that they would like, let me help with this and let me help with that. And that was really fun. It was a really good experience. Also helped solidify if I didn't like it or not. I liked it. I think that experience could also deter people. So maybe find a dental clinic in the area that would be willing to have you kind of hang out and just observe or just lurk for a while to see if it's a good thing for you.
I have a question real quick. Yeah. I'm wondering, because you spent so much time around it, like it seems like that really, you were sure that you liked it. And I wonder if maybe your colleagues that were in school that no longer like dentistry, if they only got a little bit of exposure to it. And maybe that was why. I wondered if you could comment on that.
Yeah, I mean, possibly. I will say, like, I've wanted to be a dentist for so long. And so I did have a leg up for that. And I know some of my classmates didn't even decide to apply to dental school until like their junior year of college, senior year of college, or they took a gap year and after college and then were like, oh, this is interesting, and then applied. We had in my dental class, we had like a few people like in their 40s. And so it wasn't even a like directly out of school thing for a lot of people. There were 2 people in my class who had PhDs already, and then they went to dental school. And so, yeah, I mean, I don't know if the people who don't like dentistry as much didn't spend as much time shadowing or not, or if they got out of dentistry and were like, I actually hate people. Like, I don't know. There's a lot of different factors probably at play. But you're right. I did do a lot of shadowing. And in part I did that because my parents are like, they're both from like we're in Nashville, and they were like opposite of a lot of parents. They were like, are you sure? Like, you don't have to go to dental school. Like, you don't have to make this decision. So they were like, you can like become an artist. You can do something else. And so I kind of was doing a lot of shadowing to make sure that I was sure, and to kind of not prove it, but just to like really understand what it was and what dentistry involved. Yeah, good question though. I don't know. I can't really speak for them, but that's possibly, yeah.
It's a side comment that when I was in med school, in like my first year, there was a 4th-year student who said he was gonna start working on a MPH because he was like, I don't like sick people. And I was like, how did you get to medical school if you don't like sick people?
Oh God,
So
awkward. Yeah,
yeah.
really.
So I always wondered if it was a lack of experience or exposure to like what, that kind of ugly part of the job potentially, like maybe people with bad dental health and then, but you're trying to take care of them or something. I don't know.
Yeah. And I mean, also, it does depend on where you work. Like private practice dentistry, you're not working on a lot of people that like are in heavy need. If you go into public health dentistry, that's when you're seeing really intense decay, really big oral health problems. So you can kind of pick and choose the population that would be best suited for you. Okay, I'm seeing a question. Would you say that taking some time between undergrad dental school helps explore your options? Okay, yeah. I think that's definitely a personal thing, and I know that that's a kind of a cop-out answer, so I'm sorry about that. But for me, I definitely thought about taking a gap year, and uh, but I know myself, and I really needed to keep going, and I needed to have the momentum because I knew I wanted to go to dental school, but I also know that I needed to maintain study habits for myself. And so I was like, you know what, I'm just gonna push through. And to be very transparent with all of y'all, I got really tired in dental school. so it was a slog, a little bit of a slog, at some points. At others it was wonderful because I was finally doing what I wanted to do. But in retrospect, I might have taken a gap year. In retrospect, I might have taken a gap year in between high school and college, but I know we're all past that point, so can't do that. But maybe taking a gap year, it would definitely help you kind of feel out your options if you're not sure yet, if you're not like 100% sure. It would also give you a little bit of leniency, because applying for dental school during college was tough, and taking the DAT during college is tough, studying for that. And so if you do take time off of that, in between, then you do have a little bit of breathing space. Yeah, so the DAT is the dental admissions test. Awesome. I just got a book. I like straight up got one of the DAT prep books and just worked through it. I think I did it during a summer, and I spent like a month studying for it and then just took it. And different schools accept different DAT scores, so you get like different DAT scores based on section, and you can look at schools and see like what their average DAT scores are from their accepted students. And mine were like pretty average. Like they weren't, I don't believe, up to the standard of UNC, but I did a lot because I did the shadowing, because I did so much like extra work, like to show I was interested in dentistry. I think that's why they accepted me. Yes, Samantha, hand up.
Hi. So back to speaking on like I'm a dental assistant right now.
Okay.
So back to speaking on how you were saying how like there's a lot of different ways to go as being a dentist, and you were saying like how in private practice, like you're not going to see a lot of patients, whereas right now I'm working in a pediatric Medicaid office, and our dentists see 20-30 patients a day, whether that's hygiene checks or op. So just to feed back onto what you were saying is, yeah, it depends on where you want to go. If you want a slower pace, if you want a big, faster pace.
Yeah, like, and those high production, like with
Yeah.
Medicaid, the reimbursement is so low, so you
Not
have to be
good.
going through so many. Yeah, you're totally right.
Yeah.
Yeah,
Yeah.
and
Just-
it's
yeah.
stressful. You,
Mhm.
yeah, you can probably attest to that.
Yes. Yeah, but that was just like an example as to feeding onto what you were saying.
Yeah,
Yeah.
awesome. That's a solid example. Thank you.
Sure.
Alex, do you have a question?
What topics comes in the DAT most, or what is the most thing that you remember? What is the topics that you most struggle, and which you least struggle?
Yeah, so it covers, so the sections are like, there's a math section, there's a reading comprehension section, there's organic chemistry, biology, I think general chemistry is a section. And then there is the perceptual ability test, which is the PAT, which is within the DAT. And my lowest score by far was the math section. I honestly went into it pretty confident. I was like, how hard can it be? And it was pretty hard. Just like for me, that's personal. I think a lot of people struggle with the organic chemistry section. So those were, I think, probably orgo and the bio I probably studied for the most. And because I knew that those would be a little bit tricky. The perceptual ability test was my favorite. I loved it. And that one's also really fun to study for, in my opinion. It's all like puzzles. It's like, I don't know if any of you have seen them, but it's like, look at this like two-dimensional thing, this like shape, and if you folded it up into a three-dimensional object, what shape would it make? Like stuff like that are like really, they're just like clever little puzzles that you have to figure out. So that was my best score. And I think part of it was because I had so much fun doing it, like studying for it. Like it wasn't really as stressful as the other ones were. So that one was my best one. I think like if you can learn to like the PAT and all the tests that are within the PAT, you'll do really good on it. Like you don't find it as a challenge, you just find it as like, oh, this is cool. So yeah. Okay, you put a reference in. Awesome. Did that answer your question? Okay. All right. And then let's see, moving on to more questions. So how did I make my application stand out? Awesome. So I did the like I said, I did a lot of shadowing. One of the I can't remember if she was a third or fourth year dental student at the dental clinic that I was at, gave me some really solid advice. She was like, if you're really interested in dentistry, you should go abroad and look at dentists studying abroad. And I know that not everybody has that ability, and thankfully I was able to. I like had money saved up, and I actually went to Bolivia, and I like stayed with a host family and just like went to a hospital every day and shadowed with a dentist there. And so that also I think probably made me stand out on my application to dental school. It wasn't a mission trip, and it wasn't like a school funded thing. It was me being like, I'm gonna fly to Bolivia and watch dentists do their thing. Which I think if you do mission trips, if you do school things, those are also great. And any exposure and anything that's like not just out, like anything kind of out of the norm, they're like, oh, that's interesting. Like, oh, they took an extra step. And so the same thing would go if you like went to a bunch of clinics here and shadowed and met a lot of people and watched a lot of dentists. I think it's just anything that shows that you're a little bit more motivated than other people to prove your willingness to expose yourself to dentists and like watch them and figure out if it's the right thing for you. So yeah, what's up?
I have a question as far as that goes. How did you like going to Bolivia and then contacting somebody being like, hey, can I shadow? Like, I'm from America. Like,
Yeah.
how
So,
did
okay.
that?
Granted, I went through a program, but it's a solo program. So you don't go as a group or anything. So I honestly did a lot of research on where can I go to like shadow dentists? Where can I go to work with dentists? And I went through a program called Projects Abroad, and they basically just they like connect you with people. So they connected me with the host family and they connected me with the dentist. But I went on my own. There was nobody else with me. I wasn't with a dentist. I wasn't with a group or anything like that. So it was, and I know that those programs exist like more than just this one. So if you're interested, like I would find one of those and just be like, hey, do you have a dental shadowing program? Like, what do you do? Because definitely it would be hard to find that on your own. Like I don't even know where I would begin to start that. But it's once they match you with people, it's kind of you're on your own. So it was a cool like kickstart and like boost into that a little bit. Yeah, what's up?
So I have a question for Amanda Maxwell. You think that the study abroad can help me to find, because I also want to study abroad, and I think so it will be good idea to do the same as Alice, and I want to know if the study abroad program in UNCA can also help me to find like dental programs or something that will help me to learn more.
Yeah, that's a good question, and I actually wanted to speak up because I think that just from hearing what Dr. Jamison was talking about with her experience, that is, from my perspective, really valuable is that she went kind of on her own. Because if you go with a group, you tend to stay with your group and you're getting exposed to another culture, and you're learning some things, but you're also really learning about the group you went with, who are also probably a bunch of Americans. And it's very unique when you live with a family. I've done this sort of experience too. It's very different and what I saw a lot of times is that, yeah, if you go to an organized thing where a bunch of foreigners come, then you might meet cool people from like England and France and Austria and all this, and you're like, wow, this is awesome. But I think the better experience is when you go to a country and you really get to know that country. And so, Alex, for you, sorry, my dog's getting really excited because of the thunder. But for you, or for anybody, a study abroad program through our study abroad, those are typically to give you a good experience. They may not specifically be tailored for a dental experience, but that doesn't mean that you can't make that happen. But there may be other opportunities. I also think that if you don't have the money to do that, you can have, in a way, and maybe lack of a better term, an international type of experience, or a very unique, very deep experience by working at free clinics in this country. We have a lot of people in this country who don't have access to insurance, to good health care. We have people who are economic migrants and have come to this country, and they're trying to get access to. So there are ways to have the same, have this kind of multicultural experience without having to fly to Bolivia or fly to another country. So Alex, I think this is just a further conversation, but starting, you want to start planning ahead and seeing how it could work for your schedule. So looking at it now for maybe doing it in a year would be great.
And also, like a lot of my classmates, I don't know if any of you have heard of Mission of Mercy clinics. They're called mom clinics. They're in North Carolina. Their funding was severely cut, so they haven't been a lot in the last couple of years. But a lot of my classmates would do those, and they are like pop-up clinics in one location, and they do it for like a weekend, and then they go away, and then they pop up somewhere else. And so a lot of my classmates would do like one or two of those, but I think that like a very valuable thing is like setting up a like weekly like a shadowing experience. Like you do it for a longer period of time, and you like see if you like it more than just like a one day like quick thing. But B, you develop like relationships. So if you did want a letter of recommendation and you developed a relationship with a dentist that you've been shadowing for a while, then they would be able to write you a letter of rec. I'm fairly sure I had to get one dentist to write me a letter of rec when I applied. I think it was 2 academic and 1 dentist. So I asked my dentist, since I had been shadowing her for a number of years at that point, like I would go back, like in college, I would come home for a break and I would go to her office. It was weird, but it like you develop a relationship. And so definitely studying abroad is like cool, but I think that I definitely mirror what Dr. Maxwell says, like you can get such good experiences here as well. And I think it's the like perpetuating going again and again and again that really makes you stand out from other applicants. Yeah. All right, going back to the list of questions. How many schools? Okay, y'all, I applied to 1 school and that was super weird. Like that is not normal. I got extremely lucky or what have you. I only wanted to go to UNC. I don't know why. Because I wanted to come back to North Carolina. That's why. I really wanted to come back for dental school. I only applied to UNC. I told you my DAT scores were like midline. And my logic was I'm going to apply to only UNC. And if I don't get in, then the next round I'll apply to more. We all want to apply to UNC? Yes. Okay, so I'm not alone. And then I got in, and I was like floored, because a lot of people don't get in the same, like a lot of people don't get in. First, it was my first time applying to, second, it was the first school I applied to. Very strange. I wasn't anticipating it. I was like, in my mind, I was like, so for my gap year, what am I gonna do? And then I got in. That said, I wish I had looked further. By limiting my focus to UNC and being so set on it, like in high school, I was like, oh, I'm going to go to Wisconsin for undergrad because I know I'm going to come back to North Carolina for dental school, because I was cocky. But by doing that, I didn't research other schools, and I wish I had. So UNC is great. It has a really wonderful reputation. If I had looked at other schools, I don't know if I would have gone to UNC. It has, for instance, it has all of the specialties in dentistry. So it except for one, I think. So it has like a pediatric residency. It has a endo residency, oral surgery residency. And so because of that, we didn't get a lot of those patients. Like we had to go search for like root canals, because the endo residents would take all the root canals. Whereas other dental schools, they don't have all the specialties present. And so you end up doing so many root canals. You end up doing so much oral surgery and extractions and everything, because the residents aren't like snapping up the patients. And so I definitely think it's worth looking at other places. And like, if you think like, hey, I might be interested in becoming a pediatric dentist, you could look at a place that has like a really strong pediatric program, so that you could maybe like get in with the residents and like learn some stuff. Or else you go the other way and you're like, actually, like I want pediatric patients, so I'm going to go someplace that doesn't have a pediatric residency so that I see more patients. So I would definitely look other places and kind of look at their clinical, like see if you can speak to any students. Really look more places than you think you would, because take it from me, I got to the end and I was like, I don't know if that necessarily was the best school for me. Like I graduated and it was fine and I'm a dentist, but I had such like blinders on when it came to UNC that I was really focused on it, a little too focused. So learn from my lesson. UNC, like I said, is a solid school and everybody wants to go there for like a good reason, but it's not the only school.
I just want to throw in, it's the same way with medicine. When at UNC, when you're a medical student, there's so many residents, and even the, if someone has a GI problem, you just order a GI consult. But if you are in a place like Asheville or in Hendersonville at the Rural Family Medicine Program, you are doing that yourself. You still can call a GI consult. It's just you're so much more integrally involved with stuff rather than just sending them to somebody else who's the specialist who's going to take care of it.
Yeah. Yep. Students are a great source of information. They really are. They'll tell it to you straight. You got to ask the like dirty questions. You have to be like, okay, so what's the bad? Like, what's the worst part about the school? Oh, right. How and why did I choose the MAHEC dental residency? Okay, so I don't know how much people know about residencies. I knew very little in dental school, like when I went into it and before. You do not have to do a residency for dentistry. It is completely optional. A lot of my classmates just went out and started practicing right after our graduation, our non-existent graduation in May. And so you do not have to do a residency. However, there are a lot of residencies that you can do. So if you want to specialize in dentistry, so if you want to be a pediatric dentist, oral surgeon, orthodontist, anything like that, you do a residency after dental school. So that's about they're usually 2 to 3 years, depending on the residency program. Oral surgeons then go after dental school, they go to medical school. And so it's another 4 to 6 years after the 4 years of dental school. So it's a lot of time. The residency that I am in is called a GPR. It's a general practice residency. And there's 2 residencies in dentistry that are almost paralleled. One's a GPR and one's called an AEGD, which is an advanced education general dentistry, I think. Advanced education in general dentistry. And they're both obviously optional. AEGDs, to my understanding, are a little bit more book-based. So it's like an extra year of dental school, you're learning a lot more. Whereas my GPR, it's it's just clinical. So I'm in a clinic here at MAHEC. There's 7 of us and there's attendings. And so you're doing your own dentistry. You're still a doctor, you're signing everything, but you have the attendings there in case you run into something, or you want to talk through a case, or you're treatment planning and you're like, I'm stuck on this, help me out. And they're here for you. So you're essentially getting another year of clinical work under your belt before you go out on your own. And I wanted to do that because I felt like I just needed a little bit more clinical experience before I went into the real world. And then the pandemic hit and I was super glad I did a residency because our school ended in March and I missed out on the last 3 months of clinical work at UNC. So I really like it. That's the reason I chose to do it, was just because I wanted a little bit more experience. Can I go over the interview process? Absolutely. So you apply to schools and they then get in touch with you to offer you an interview. And you go to the school. So that's another, it's pricey to go. They tell you 2 weeks before your interview date. It's not great. So I had to fly from Wisconsin back to I went to Chapel Hill. I flew back to North Carolina. I didn't even see my parents. So it's a short trip basically. And the way that my interview went was, it starts really early in the morning. I had 2 faculty interviews and then 1 student interview, and they're spaced throughout the day. So you have 1 interview with 1 faculty member that's about 30 minutes, and then you do a tour of the school, and then you have your second faculty interview, and then you tour the clinics and do an info session about financial aid and stuff like this, and then you have your I had my student interview last, and the student was a 3rd-year dental student, so they're kind of gauging, just gauging you as a person, really. Because your application tells them so much, and then they're just curious, like, are you a good person? Do you say really awful things in person? Stuff like that. That said, I also participated in the interview process during my last year there. So I got it from the opposite side as well. So I can tell you this as well. We all meet together afterwards. So the faculty member and the student. So they're basically comparing notes. So you don't want to like act like a completely different person with one versus the other. Like, be yourself, be as genuine as you can, because they're all kind of they talk about you, as I'm sure like you would guess that, like, all of your interviews will be like, what did this person, how'd they strike you, like, what do you think of them? And so I would say, yeah, it's a really stressful day. It's a really stressful day. So like the night before, definitely try to get sleep, definitely eat, because you are like at your best for a sustained period of time all day on your interview day. And it's very exhausting. And so you definitely want to just prepare yourself mentally. And I can't stress enough, just like be yourself, be really genuine, because that's what they want. They just want to get to know you as a person. One of my faculty interviewers, and like at the end of my interview, one of my interviews asked me what my weakness is, like one of my biggest weaknesses. And I was very honest, is that like at that point in my life, I've done a lot of work on this, is I was really scared of standardized testing. And I said that to him, as I was like, I don't perform well under pressure with standardized tests. And this was, mind you, after the DAT, like they know my scores, everything like this. And I was like, I'm just not the most confident with standardized testing and like timed issues. And he asked me, why do you think then you would be a good fit in dental school? And I said, because I work hard. So like stuff like this, like they're gonna throw you like weird questions, and like just be honest. Like I was honest with my testing. Like I had a lot of test taking anxiety in college and everything like that, and I said that as a weakness, and it was okay. So really I also practiced a lot. Like I just got a list of like interview questions that maybe asked, and I just went over them with my roommates. Like leading up to my interview, when I found out I got an interview, I just sat down and they're like, okay, what about this question? What about this question? And they'd be like, that wasn't a good answer. Like, like think maybe phrase it differently. So like just practice it and just get comfortable in like your responses and bouncing back from like weird questions. There was one question that the one faculty, I didn't have them asked, which was, if you were a grape, what would you be? It was so weird. He was like, would you be like you'd have to, some people were like, I'd be a wine, like I'd be a raisin, I'd be jam or jelly. Like it was the weirdest question. So you get some like weird things asked. Do you have anything else specific about interviews? Okay. Did that answer give you a good idea of it?
Yeah, thank you.
Yeah. Okay. Okay, so as Dr. Maxwell mentioned, I'm also doing my Master's of Public Health at the same time. And I decided to do that because in my shadowing, when I was shadowing at this dental clinic, I became really interested in public health dentistry. And like Medicaid-based practices, federally qualified health centers, also known as FQHCs. And that's where I really want to be involved with that. I really want to work in that kind of setting. And dental school, as I mentioned at the very beginning, kind of shunts you into a very narrowed practice. And so like they're like, oh, private practice is like the channel that people go to unless they specialize. And we only had like 2 classes on public health. And I was like, this isn't enough to work in public health dentistry for my life. And so that's why I decided to do the Master's of Public Health, is I was like, I need more. I need to know how best to serve these communities and how best to like work in these populations without stepping on toes and everything like that. So that's why I decided to do the MPH. It's great. I really like the program. I'm in the satellite. It's a UNC degree, but it's a satellite at MAHEC. And if any of you guys are interested in that, also a great program. There is one student here who just graduated from UNC, and she's now in this program. I know multiple of my classmates who did an MPH before going to dental school, because that also does give you a leg up, is that you have you've proven that you can work at a higher level. So you will have done a master's, you can do graduate level work. And so that does also make you stand out. So I know multiple of my classmates who had MPHs before going to dental school. So if any of you are interested in the MPH, also a really great program, also gives you a little bit of time, as somebody mentioned, like if you don't really know if you want to go to dental school, it's also a really valuable degree. So it's not necessarily like, oh, I'm just killing time doing another degree. An MPH teaches you a lot and is a leg up, I think, in a lot of careers. There's some chats, hold on. Which was more difficult, undergrad or dental school? Dental school, definitely. I would say that they were difficult in different ways. So undergrad was really difficult for me because I was really far from home. That was a really, really hard adjustment for me. I had never really gone far from home, and I went from North Carolina to Wisconsin and left my family behind. So coping with that was really hard for me. The dental school is just a lot of work. It's just like you are like pushing. That said, I tried really hard. I just like, that's it, just in my nature, is I worked really hard in dental school. You don't need to. And I'm sorry, Dr. Maxwell, I'm just going the really like transparent route, is like, a lot of my classmates had a really great time in dental school and partied a lot. And guess what? They're still dentists. And if you want to specialize, like if you are looking to go into one of these residencies, they care about your grades. And so the people who specialized were a lot more serious about their grades than people who did not want to specialize. It's really what you make of it. It's what you want to get out of it. I went to every single class in dental school because that's like who I am. A lot of people went to like half of the classes because like a lot of them were recorded. There was 82 people in my class, and I remember one time there was 4 of us in a classroom. So it just goes to show, like, that's just who I am. Is I went to every class, and I probably made it more difficult for myself because I set a bar that was really, really high. Retrospect is 2020. If I did it differently, I might not care as much. So it's a very personal journey through it. And dental school does not have to be as hard as maximum possible. But you definitely want to like put in the time and effort to learn what your career is going to be. But I would say the dental school was harder for me just because of the amount of work. Yeah.
Can I just pipe up real quick? So about like a comparison, in medical school, the first year was the hardest because it's so different from what you're used to. The second year, it's harder. They give you more information to learn. It's a little bit harder, faster pace, but you know what the routine is. Like, like this is my lifestyle. But in medical school, it was pretty much like in undergrad, I had all these other things going on. But in medical school, it was pretty much just medical school. Like, you just study all the time. And so I think that it kind of going in with that, I wonder, I don't know about dentistry, but or dental school, but going in with that mindset of this is what I do, and I'm going to focus like 90% of my attention on this, kind of changes the dynamic from undergrad to graduate. But there are some, and also at UNC, I mean, it is, they take, at least with the medical school, 80% of their students are from in-state, and then 20% are from out of state. And there were a lot of really brilliant people that I went to school with, and they did party a lot. And I couldn't personally. I had to study and put in that time and get a full night's sleep and things like that. But so, just I would go in with a serious view, but then in retrospect, you kind of realize, yeah, take it, you mute, and we'll get back to you. I'm gonna pause the recording.
Yeah, I would say definitely go into it with an open mind. Albert, what were you referring to? Surprising in the chat.
So I was referring to with that sort of like shunting into private practice and sort of like the lack of, I guess, time and teaching about public health within and your experience with that. And so I was wondering if you had a chance in that time to really ask faculty like why that was without really stepping on their toes.
Yeah. So I got close with a couple faculty at the dental school who were dually assigned. They were faculty at the dental school and at the public health school, which is across the street from the dental school in Chapel Hill. And so like I did have this conversation with them. And of course I didn't step on toes because they were public health people. And so they like really wanted there to be more public health. I'm trying to think, the thing that stood out to me the most was, and a possible reason why they push private practice so much, is that private practice dentists make a lot of money. And the more alumni they have in really high places who are making a lot of money, the more money the school gets, like donations back and everything. Public health dentists, you make a good living, but you're not going to be making the kind of money that private practice dentists are. And then I'm also going to say something that is completely my opinion. And so it's like not super fact-based, so take it with a grain of salt, is dentistry is a little bit more of a conservative career in my experience. And dentists tend to be more conservative, at least the ones that I was with in Chapel Hill. And I'll be very transparent. I want to go into public health. I'm pretty liberal, and I believe in like Medicaid and think it's really important. And one of the two classes that we took in public health where we learned about Medicaid, a number of my classmates complained to the administration that the professor was pushing the liberal agenda by teaching us about Medicaid. So, which is really disheartening, because we should know about Medicaid as dentists, in my opinion. So that said, I don't want to skew your views on this or anything, but they don't teach a lot of public health in Chapel Hill. I don't know about other dental schools. So I will say that's another good reason to like look other places. Maybe if you're really interested. I knew I was interested in public health and I didn't look other places. And maybe there's other dental schools out there. I know that like dental schools in New York City, they do so much like high numbers in their clinic. And so they are inherently more public health than some other dental schools that are located in different places. So that's just my experience at Chapel Hill. And I didn't step on toes because the public health dentists that were there were like, we want more public health in the curriculum, but there was a lot of pushback, unfortunately. Is there a lot of diversity in dental school? No, not as much as there needs to be. There is always room for more. And unfortunately, there wasn't a ton in my class. And I think there's more diversity in the class below me, like the current fourth years now, but it is predominantly white. And that sucks. I'm not gonna lie. It's not a great fact. And in terms of gender, it's now about 50-50 in terms of individuals identifying as female and male. And there, I will say there's always more room. We need more diversity always. And yeah, so I don't know the exact numbers, unfortunately, but I will say that that is something that I think that the schools are becoming more aware of. My beginning of my last year, one of my close faculty mentors started chairing a diversity committee there to help awareness of the school in the school, and also recruiting and reaching out to individuals in high schools and colleges to gauge interest in dentistry, because yeah, it is a very white predominant. My class was predominantly white, so yep. Did that answer that question? I'm sorry, I don't have like numbers or anything. Okay. Yeah. Okay. How often do you get called or want to call? Well, I've gotten called twice while sitting here. One time was nothing. The other one, a lot of them are, some questions are just like on the phone questions. Some questions you like go into the hospital. I haven't gone in this week. I've been called probably like a dozen times, just like questions. Bad weeks, I get called in quite a bit on the weekends for people who are drunk and get in fights, or small children who play in like sports events and get like elbowed in the face. It's a very cool learning experience though. And I feel like I've gained a lot in dental emergencies. Before this, I was like, I don't know how to put a tooth back in. And now I'm like, okay, I'm gonna shove this tooth back in where it goes. So like I've gained a lot. It's a pain when you wake up in the middle of the night when you're like, oh, I just drifted off to sleep and the phone rings at like 2 a.m. And that's a pain, but it's worth it. It's like I've gained a lot. And then when the residency's over, I never have to be on call ever again. Being in a Medicaid office, vouch for that. Yeah. Yeah, Samantha. You have a lot of insight to this. What was something that helped me the most to get into dental school? I would say going back just to like the application itself, all the activities that I could possibly do to show that I was interested in dentistry really helped me get into dental school. And then the actual like interview itself, I think I just tried to be as myself as possible and get that across to them and engage them and everything. I will say a couple of people that I interviewed the one time that I did it, the ones that didn't impress me the most were the ones that really didn't want to talk. Like, and it was like a really halted conversation. Is if you can just show that you're interested, that's all like we really want. Is like if you don't want to talk about yourself anymore, just have some questions prepared then and talk to me about like my experience or ask me questions or anything like that. So if you're in an interview and you have run out of things to say about yourself, which is totally fine. I know a lot of people who do not like talking about themselves. Just have some questions and like be like, oh, how did you get into dentistry? Like, what do you like the most? Blah, blah, blah. So I think that helped a lot. One thing I forgot to say is that in college, oh my gosh, I know I'm past time. I'm sorry. I minored in sculpture. I did art. And I think that was also something that helped me stand out. They ask you about that. They're like, do you have any skills with your hands? So they ask if you play instruments. They ask about like art, like, do you have arts? Like, I don't know if they ask this, but like, you do arts and crafts, put that on there. Be like, oh, I love sewing. Oh, I love unique things. So like, if you can do tiny things, if you make jewelry, if you make earrings, that kind of thing, that helps a lot. Okay, I'm out of time, I believe. I don't think I got through all the questions, but.
No, you did. The only, just any additional helpful thoughts or suggestions, but I think you covered a lot of it. And I'm glad you that is one of the things. I think there's actually a question on the application for dentistry that like about what manual dexterity things do you do? And I assume it's because you're going to be working with your hands. Your eye-hand coordination is so important. Like you can be a physician who, you know, and kind of bumble your way through the medical or through the physical exam, but know the right test to order and stuff, you know, or the right questions to ask. But with dentistry, you've got to be good with your hands. So
yeah, absolutely. That said, everybody's trash with their hands at first. Like it doesn't matter how much like manual dexterity you have. The first day you're in sim lab and everybody's like looking in the mirror in the little fake heads and you're like trying to drill on teeth. Everybody's bad. Everybody's like, oh, I thought I was going to be so much better at this. No, everybody's bad.
Thank you so much for your time tonight. This is just invaluable for students to be able to hear from somebody, hear different perspectives, and get this extra insight. So we really, really appreciate it.
And Albert, you asked about contact information. Do you want me to just put my number? I'm totally fine if you guys text me or want to set up a phone call or anything. Should I put it in here? Should I give it? Dr. Maxwell, you have it. You can also send it out if you want.
Okay. Yeah. And you know what might be that once, you know, we're kind of past the COVID and a bunch of people are vaccinated, I'm thinking about in the fall, it would be awesome to like, I assume you'll still sort of be in the area since
I'm gonna be here.
Cool. Maybe we can have other events and actually get in the same place and just chat and stuff. So yeah, if y'all want to get in touch with Dr. Jamison, just let me know. And I just want to throw out too, if y'all have not signed up for, let's see if I can be quick on the draw on this, the pre-health interest groups email address, or I'm sorry, email list. I can't think and talk at the same time. Please sign up because I send out special invites. So like if you filled out that form and you say dentistry is one of your interests, then you will get the special invites to things. So.
Thank you.
All right.
Yeah, no problem. And really like y'all, if you have questions, don't hesitate. I will say I'm not a good texter in terms of timeline. And so if you text me a question and I don't respond with a day, be like, hey, did you see my question? And I will get back to it. I promise.
I train them well for that too. I'm like, send me emails once a week and remind me.
Yay. But I'm always down to talk about dentistry or answer any questions or the MPH program if you guys are interested in that. So yeah, don't hesitate.
Thanks again. We really appreciate it. Have a wonderful night.
Thank you. Bye y'all.
Bye-bye.